Hello everyone. Now we are going to see about lateral medullary syndrome. What is lateral medullary syndrome? The lateral medullary syndrome is also known as Wallenburg syndrome. So here in lateral medullary syndrome, you should know that the lateral part of the medulla is supplied by the PICA. What is PICA? PICA is the posterior inferior cerebellar artery. So from where does the posterior inferior cerebellar artery arise? It arises from the vertebral artery, which gives rise to the basilar artery, and here we have the posterior cerebral artery. So this vertebral artery is the one which gives rise to posterior inferior cerebellar artery. The posterior inferior cerebellar artery supplies the lateral part of the medulla. In addition to it, the lateral part of the medulla will also be housing four important cranial nuclei, that is the 9, 10, 11, 12. The 9, 10, 11, 12 are the one. So if you see, the 9 is the glossopharyngeal, 10 is the vagus, and even the hypoglossal nerve, that is the 12th. All these are needed for the proper coordination of swallowing. So therefore, when there is a lateral medullary syndrome, that is when the PICA is infected, then it presents with dysphagia. That is the first symptom. In addition to it, the sympathetic trunk is also affected. How? The sympathetic trunk is the one which arises, the sympathetic impulses are arising from hypothalamus, and it passes through the lateral part of the midbrain pons as well as the medulla, especially in the lateral part of the medulla, and then it reaches the C8 to T1 cervical till this T1, and then till now it has not anastomosed anywhere, and finally it reaches the superior cervical ganglion where it anastomoses. So till now it is a first order neuron. What is a first order neuron? That neuron before its anastomosis, that is the first order neuron. Then it finds a ganglia, it anastomoses over there, and the second order neuron takes over from there. So now from the hypothalamus, and that sympathetic impulses are travel through the from the hypothalamus, that is from the midbrain as the first order neuron from the hypothalamus through the brain, midbrain pons medulla, so in the lateral part of the medulla till the superior cervical ganglion. Now when that lateral part of the medulla is affected by the posterior inferior cerebellar artery infarction, then it presents with dysphagia as well as loss of sympathetic chain, and therefore we have all the symptoms. Now I have another one. You should know that the Pankos tumor also causes the same syndrome, that is the Horner syndrome, which arises from when there is a loss of sympathetic trunk. But what is a Horner syndrome? Horner syndrome is a constellation of symptoms, like they will be having meiosis, they will be having anhidrosis, they will be having a ptosis, and a loss of ciliospinal reflex. So all these four that are the components of the Horner syndrome is lost in Pankos tumor. Why? This is because the Pankos tumor is the tumor that arises from the apex of the lung. So when that apex of the lung has a tumor, then it will impinge the superior cervical ganglion, which lies exactly at the bifurcation of the common carotid artery, that is more closer to the internal carotid artery. When the apex of the lung impinges the superior cervical ganglion, then it presents as Horner syndrome. Similarly, when there is a lateral medulla is infarcted, as seen in Wallenburg syndrome, where the sympathetic impulse arises from the brain, that also presents as Horner syndrome. So this is in short about a Wallenburg syndrome or a lateral medullary syndrome. I hope I made this clear. Thank you for listening all this while. All the best for your exams.